So I had attended a national health tech conference that year and had heard about the programme from a speaker who I subsequently had a conversation with. And it was a really valuable conversation because they encouraged me to apply for the programme. There were only 2 weeks left to apply, and so I spoke with a couple of other people who had been on the programme, and there was so much positive feedback. I'd had some ideas about health technology, and I felt that the programme could support me to turn these into reality.
I learned about the Digital Academy from being on the Digital Pioneer Fellowship Scheme, and I thought that this would be a great opportunity to further my development. And having seen what previous cohorts had been doing in digital transformation, digital innovation, and the amazing barriers that they've been breaking down, I felt like I wanted to be part of this movement.
So it was one of those things I'd heard in the background, but never really thought it was of interest to me specifically, because I really thought it was more for sort of clinical digital people, so CCIOs mainly, and I hadn't really given it any more thought. Then I sort of spoke to a couple of people who had applied on Cohort 1 and was sort of surprisingly shocked that they had applied and thought, oh, you don't fit the cohort I thought was eligible. But again, really, just sort of thought, okay, interesting. Then I heard some of my friends and stuff applying for Cohort 2 and suddenly realised, I think I'm missing out on something here.
The virtual residentials are a really good opportunity to consolidate some of the learning and to hear from digital leaders in a variety of roles across the country. The people in my peer group are absolutely amazing. I feel like we are a family, and there's so much motivation, support and encouragement that goes on across the peer group.
For me, I think that the most important part of the learning so far has been around using theory in strategy design and strategy development, and how it can benefit digital interventions.
My most favourite part of this programme is the people. The peer group that I've got are amazing. It's been, some of them I already knew, which was surprising because we had known each other very much in a sort of work format. We go to meetings together, we knew about each other. They became part of my peer network group, and we've sort of going through the Digital Academy together, and we've really got to know each other and support each other. So I found that side of it really, really fantastic. And it's also allowed me to almost become or have a better understanding of healthcare in the Southeast, where I work and my peer group are part of, in a much different light, because I'm speaking to clinicians, so I'm seeing it from their side. I understand now some of the pressures that the national team might give to them, and I work in the national team. So it's really opened my eyes, and more importantly, I've got a great group of people that I can rely on. We've really supported each other through this programme.
In terms of the challenge, a lot of this is online, so you do need to be incredibly self-motivated to take the work forward. It has been challenging due to the pandemic pressures in the workplace, and fitting things, around those pressures in work. So, working in the evenings and weekends. And I knew it would be really hard, and it would be tough when I joined. But at the same time, it's so incredibly rewarding to have the learning outcomes at the end of it.
Part of the programme involves self-reflection and being able to criticise your own biases and your own learning. That's been slightly challenging for me. However, I can see the benefit of doing that because it embraces a culture of learning and development, which you can then take back to your workplace.
Even when I got into the Digital Academy, I thought, will I be able to do this? I knew it was going to be hard work. And when I first got into doing sort of like the academic side of it, which I haven't done for some time, initially I was a bit like, oh my goodness me, what have I got myself in for? But actually, as again, the teaching staff are great. They're really supportive, and my peer group, have supported me all the way through it. So although it's hard, I'm not going to lie, it's not an easy program to be part of. It is worth it.
I feel that the reflective journals have really helped me to bring theoretical knowledge to life in work and to understand how theory can be applied into practice. So, for instance, the current reflection on the subject of technology strategy and health information systems is strongly aligned to my programme of work, so it's really valuable.
In my current role, I think being part of the Digital Academy, what it's really helped me with is, as I said, think a bit differently about the current role that I have, and therefore, more importantly, what influence I have. Maybe I didn't realise how much influence I had in my role. So that's been really refreshing, because not only have I got influence in what I do from a regional and national point of view, in terms of policy setting, in terms of where we can really make a difference in terms of digital transformation, I've also now got access to other people who've been on the Digital Academy who also feel the same way. As an individual, it's made me think about my personality, what my strengths and weaknesses are, where I should be investing a bit more of my time. But also, I think for me, where I can be helping others, similar to me. So how do I help other Black women realise their potential? How do I encourage them to go onto programmes like this? How do I help women in general, be part of the digital transformation programme?
So I guess when I applied, I really didn't think that I would be successful in the application process. I thought there were other professionals more eligible than myself. I didn't think I was qualified enough to apply, and I knew how competitive it was to get onto the programme. So I was really, really surprised when I'd heard that the application was successful. I would say that if you have an interest in the area and you love learning, then to absolutely go for it and to put in an application and to see where it takes you.
Being on the Digital Academy allows you to meet with like-minded people, and you'll find that many of the cohort become people that you would go to for support going forward. It's also a great opportunity to take your learning into a real life setting.
Do you know what? It's really stretched me. I don't think you're ever going to have a chance to be part of a programme that is specific to the NHS, which is great. And even more so specific to digital transformation. So that's the space that I work in. So I would recommend that anybody who wants to move forward in this space, this is really a great course to be part of, and the knowledge it gives you is great. And you're part of then a collective of cohorts 1, 2 and 3. So there's a load of like-minded people that are behind you. And even more importantly, if you wanted to, you can upgrade to the masters. I mean, that's a great opportunity for anybody who hasn't got one or wants another one, for example. So yeah, I would definitely recommend a lot more people to go for it. And it isn't limited to CCIOs, which is great. It's for anybody, clinical or non-clinical. So it's a really great opportunity to be part of that.